Hello everyone, welcome to another video. So in today's video we will be talking about another major condition particularly affecting the ears. So we'll be talking about otitis media or otitis media. So we're talking about otitis media, and basically otitis media refers to the inflammation or infection of the middle ear, which is the air-filled space behind the eardrum. So it typically occurs following an upper respiratory tract infection, especially in children, and it can be acute, it can be recurrent, it can be chronic, depending on the frequency and the duration. So there are three main clinical types of this otitis media. Number one, acute otitis media, which is a rapid onset of symptoms due to infection. Then we have otitis media with effusion, so fluid in the middle ear. There's usually fluid in the middle ear without signs of active infection. Then we have chronic suppurative otitis media, and this is basically persistent infection with perforation and discharge. So looking at the background, the eustachian tube connects the middle ear to the nasopharynx, and it allows for drainage and pressure equalization. So infections, allergies, or anatomical abnormalities can block this tube, this eustachian tube, leading to fluid accumulation in the middle ear, and this becomes a medium for bacterial growth. So usually children are more susceptible to this otitis media due to having a shorter and a more horizontal eustachian tube, making it easier for pathogens to travel from the throat to the ear. So looking at the signs and symptoms of this otitis media, so first we have ear pain known as otalgia, which is sudden and severe, especially in acute infections. Then we have fever, which may be low-grade fever or high-grade fever, and this fever symptom is more common in children. Then we have hearing loss due to the fluid dampening sound conduction. Then we have there will be a lot of irritability in infants and a lot of crying due to the pain and the feeling of not being, the feeling that something is just making them so uncomfortable around that area. Then discharge, there will be discharge from the ear if the tympanic membrane ruptures, and then there will be tinnitus in some adults, and vertigo can occur or imbalance in cases of severe infections or chronic infections. So looking at the clinical presentation, acute otitis media could when we have cases of acute otitis media, there will be fever, there will be pain, there will be the bulging of the tympanic membrane, there will be redness. Then when it's cases of otitis media with effusion, there will be fluid behind the eardrum, and there's usually no pain in this case. Then when it comes to chronic suppurative, chronic suppurative otitis media, there will be a persistent ear discharge and possible hear loss too. So looking at the etiology, that is the cause of this condition. So when we are looking at the infectious causes, so it can be caused by bacteria or virus. So some of the bacteria that can cause otitis media, we have Streptococcus pneumoniae, we have Haemophilus influenza, Moraxella catarrhalis, and group A Streptococcus too. So this group of bacteria can cause otitis media. Then when it comes to the viruses like respiratory syncytial virus and influenza virus and rhinoviruses. So basically viruses that are known to be the major cause of upper respiratory tract infections, they can lead to this condition. Then for non-infectious causes, it could be caused by allergy, mechanical obstruction, like something obstructing the ear, and it could be caused by barotrauma, so that is airplane pressure changes. So looking at the risk factors, the risk factors, infants that are under the age of 5 years, then exposure to tobacco smoke, giving formula feeding in children instead of giving them breast milk, frequent upper respiratory infections, and genetic predisposition too. And also when the child has Down syndrome is also a risk factor, or when the child has cleft palate, and using of pacifiers to beyond 6 months of age is also a risk factor. So looking at the anatomy and the physiology, the middle ear is bounded by the tympanic membrane, and it contains the ossicles, that is the malleus, the incus, and the stapes. So the middle ear contains these ossicles. So the eustachian tube maintains air pressure and it allows drainage. So when the eustachian tube is blocked, the air is absorbed and negative pressure pulls fluid into the middle ear. And if this fluid is not cleared, this fluid may become infected. So the initial event often begins with, when we're looking at the pathophysiology, the initial event often begins with a viral upper respiratory tract infection causing inflammation. Then there is eustachian tube dysfunction, which causes swelling or blockage due to like swelling or blockage that will lead to poor drainage. Then fluid accumulation occurs. So the negative pressure causes fluid to build up behind the eardrum, and then bacteria or viruses, they multiply in this stagnant fluid that has accumulated, causing inflammation and other various symptoms. So looking at the diagnosis, something called otoscopy can be done to show the presence of bulging tympanic membrane or decreased mobility on pneumatic otoscopy. Then something called tympanometry can be done too, which basically confirms that there is presence of fluid in the middle ear. And then audiometry to access the level of hearing loss when there is chronic otitis media in chronic cases. Then the discharge that is gotten from the ear can be cultured, and this discharge is mostly gotten in chronic suppurative cases, so it can be cultured, and then we know the causative organism of the infection. So looking at the differential diagnosis, other conditions that could mirror the same symptoms as otitis media. So we have sinusitis, eustachian tube dysfunction, otitis externa, which is also known as swimmer's ear, and barotrauma. So these conditions could mirror the same signs and symptoms as otitis media. So for the approach considerations or the management of this condition, so we look at the supportive therapy, how we could support the patient in cases like this. So we can give, for the pain or the fever, we can give paracetamol, ibuprofen. Then we can also use warm compress for comfort. Warm compress can also help with the pain. And then we also encourage hydration. Then looking at the pharmacotherapy or the antibiotics that we could give, first line antibiotics we give in this case of otitis media is amoxicillin. So we can give amoxicillin divided into 2 doses for 5 to 10 days. Then if there's no improvement with amoxicillin after like 48 to 72 hours, or if the symptoms are very severe, we switch to the combination amoxicillin plus clavulanic acid, which is broad spectrum, and it covers the beta lactamase producing bacteria. So it's a stronger alternative to just using only amoxicillin. Then if the patient has a penicillin allergy, they are reacting to penicillin, we could also give an alternative of cefuroxime, and we could also give azithromycin or clarithromycin in cases of severe allergy. So for chronic or recurrent cases of this otitis media, we could use topical antibiotic drops that contain ciprofloxacin if discharge is present. And then we could do an audiology referral if the person's hearing is impaired. So in cases of this otitis media, it's better to ensure that the patient has the correct dose, taking it at the correct time, and using the correct dose, the correct frequency, and the correct duration. And then monitoring for possible side effects like diarrhea or the penicillin allergy that I mentioned. So most children, they recover within 2 to 3 days with or without antibiotics, and hearing typically returns to normal after the infection has cleared from the system. And then chronic cases may lead to persistent hearing loss, it may lead to speech delays, or it may lead to learning difficulties. So proper antibiotic therapy basically reduces the risk of getting complications, and some of the complications that can be gotten if this otitis media is not well managed. So for number one, tympanic membrane perforation, as perforation of the eardrum, and then the child could also get like meningitis, permanent hearing loss, speech and language delay, especially in very young children. So these are the complications that could occur if this otitis media is not well managed. So the best thing is to take the appropriate medication and take the appropriate precautions. So that is it for this topic. See you in the next video. Bye.